All right, everybody, welcome back for another episode of the Barbell Therapy Podcast. I'm your host, Dr. Brett Scott, and with me here today, very excited for this episode, I have Dr. Ryan DeBell with me. Ryan is the host of the Movement Fix podcast, which is actually one of the first podcasts I ever got into and started listening to, especially when I was in PT school. And if you guys like podcasts and like learning about movement and strength training and health, I would definitely check it out. Ryan, you have your degree. You have a degree in business information technology, and you also have your doctorate in chiropractic, but you don't actually identify as a chiropractor, and it says that right on your website. So first of all, can you tell us a little bit about why you don't identify as a chiropractor?
Yeah, I also have a master's degree in exercise science, which I did at the same time as the chiropractic degree, which I don't know if they do that in any PT schools, but at the University of Western States where I went, they started offering like a dual degree. But yeah, so why do I not identify as a chiropractor? I think that anytime we put identifications on ourselves like that, it basically closes us off. Because if you think about it, like, why does a person go to chiropractic school or physical therapy school? It's like you need a license to treat people in this country the way that we have it set up, essentially, right? Like, you can't just treat people's pain. I mean, you could, but like, if you're going to be a law-abiding citizen, it's like you need a license, you need knowledge, you need skills. And so people either they apply to PT school and get rejected, and then they go to chiropractic school, or they just go to chiropractic school because they had a really great experience with a chiropractor themselves, or people go to physical therapy school because they think chiropractors are full of shit, or blah, 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 right? There's a million reasons why people choose one or the other. But to me, it's like, it's a way to have the ability to help other human beings not have pain in their bodies, essentially. So it's like, if I call myself like, I'm a chiropractor, it's like, no, like, I'm not going to box myself in like that. Like, I'm a human being who studied at a school that's called a chiropractic school that teaches certain things. And then I get a license to then I can bill insurance and I can legally treat people. But if I, labeling myself, it's like, well, I'm a chiropractor. That means I have enemies in other professions. That means I treat this way. And it's like, why would I pin myself down like that?
Yep.
I don't like being pinned down. It's like, yes, I studied that, but I'm trying to help this person in front of me with the thing that is their problem. It's not about what my profession is, And
so are you taking that route because of how people can perceive how a chiropractor would treat versus a physical therapist, and you're just trying to keep yourself out of that from judgment of others, or for your own good of, I don't want to think just like a chiropractor would think, I want to think like somebody that's just helping someone would be, or both?
Exactly. The second one.
Okay.
No, the second one. Like, I don't care. Like, some people think physical therapists suck.
Oh, yeah.
Some people think a lot of people think chiropractors are wackos and they're going to give you a stroke if you go see them, which maybe that does happen sometimes. That's obviously a huge debate, but it's really more like, I don't want to spend any of my time like identifying as a labeled professional when like the whole point of what I'm doing is to help this person. And then like, what if physical therapists what if things that physical therapists are doing are really good? Well, I'm a chiropractor, I do it this way. It's like, that's, I don't know, tribalistic, like, less evolved human perspective, I would say.
Yeah. So the big thing I wanted to get into in this episode is everyone always wants to know the difference between chiropractic and PT. And people get confused too, because I'm a physical therapist that does manipulations, or what some people know is adjustments, which we can't call them because of laws and lobbying. Yep. Yeah. We're not allowed to say we do adjustments.
That's like a First Amendment right. Yeah. Like, you don't have freedom of speech.
Basically. We can only call them manipulations. And so
I prefer just as a side, I prefer to call it a manipulation.
Oh.
Because that's what it is, right? It's a joint manipulation, meaning that you move the joint very fast, not very deep. Like a high velocity, low amplitude motion of a joint is a manipulation.
Yeah.
And all other grades are mobilizations. So calling it an adjustment is like, well, it is a manipulation.
I want to talk about that too. There's a lot I can talk about with you today. This is good. First of all, what is like the background? Because I don't really know, and I want to have a better answer for my patients too. Of like, should I go see a chiropractor for this, or what do you think about chiropractic? And it's like, well, I always say, I'm like, well, there's good PTs, there's bad PTs, there's good chiros, there's bad chiros. Like, there's good and bad of all professions, right? But as a whole, there can be a whole lot of overlap in our professions, right? So, especially now, it seems like more of the younger clinicians that are coming out of school, there's more science behind exercise and strength training and all that. So there's more of like what I've seen is like this rehab chiro approach. So like I know people that are chiropractors that treat very similar to me. But there's also chiros I know that treat a way I would never want to treat or would think of treating. So same. Yeah. Okay. Good to know. And then, I think there's a difference between the training, the background, the philosophies and science, or what some people call pseudoscience of chiropractic, or what PTs talk shit about the chiropractic profession with some pseudoscience, can be a whole lot different. So how would you describe, like, what is the training and background that you guys have going through chiropractic school? And do you know how it's different from physical therapy at all?
Well, I mean, I've never personally gone through a physical therapy program, so I can't really speak to like what the curriculum is. But the chiropractic profession is a very interesting profession. It's like there's a lot of variance from school to school, even. So the program that I went to is quite different from some of the more let's call them philosophical schools, because there's like science based schools that are very much like, we are trying to teach based on research and evidence. And then there's schools that teach more on like this original philosophy of chiropractic. And that original philosophy of chiropractic, I would basically summarize it from my understanding that basically, like, if you think about like a human being, essentially you could think of it as like, it's like the central nervous system, like you have this nervous energy, right? Like from your brain and your spinal cord, that's like the root of your life, essentially. And out of your central nervous system comes like all of your life force, let's say, right? The thing that is alive, right? Because like this table isn't alive, but I'm alive. So there's some sort of life energy inside of me. And they think that like when there's a misalignment, or let's call it like, I mean, would you agree that like if I take my spine into extension or rotation, like the intervertebral foramen size can close and sort of like impinge down on some of the nerves, right? And that's why people have radiculopathy. If they're so clearly like that, there is a way to orient the spine where there's more space for the spinal cord and there's more space for the nerve roots. I think that every physical therapist would agree with that. Otherwise, why are you doing a nerve tension test? Why are you doing a compression test, right? And so I think that the philosophical chiropractor would basically say that when there is a alignment issue of the skull and any of the vertebrae, that the nervous energy is not able to move through the central nervous system optimally. And so it's kind of like it's less physical. I mean, it's kind of like a mixture of like a sort of energetic, spiritual way of looking at what a human being is and the physical structure of the human body. And that's like sort of the philosophical approach. And so they'll look at like they'll try to like interpret if the vertebrae are in the right orientation to each other. And then they look to orient them for optimal nervous system function, essentially. So you have that. And then there's like these books. I think they're called the green books in chiropractic that are like the original philosophical books. And there's schools that they are trying to follow the philosophy of this original philosophy. And then there's the more sciencey based school, like the one I went to, University of Western States in Portland, which is more of what you're seeing when you say like a chiropractor who's like strength and conditioning, movement, rehab chiropractor, which is how I practiced when I had my clinic. I think that the way those chiropractors treat and the way physical therapists treat probably like yourself is almost like more of the same profession. Mm-hmm. Like it's almost like those two groups of people you could almost call them a different title.
Yeah, that's why I've seen it's like a rehab chiropractor is like the term I've seen kind of coined now.
Yeah, or like a sports chiro, I think is what a lot of the chiropractors themselves are like. Yeah, I'm a rehab chiro, I'm a sports chiro. And basically that means I don't just manipulate. Mm-hmm. So a lot of these like philosophical chiropractors, they won't do any exercise, like they wouldn't do like strength and conditioning type of exercises. They're very focused on doing the manipulation to try to correct the alignment so that the nervous system energy is not impeded by compression or not optimal nervous system
outflow,
tension, outflow, right?
Yeah.
And people say outflow and they think it's like kind of woo woo, but it's like, hey, if you have a disc herniation and your foot's asleep, I mean, you kind of don't have outflow. Like,
yeah.
So that's why, like, if you try to, if you identify so hard as one profession or the other, you're already biased. And it's like as if these chiropractors are trying to scam people. Like, I have a belief that like nobody's really trying to scam people. It's not like I'm going to go be a chiropractor to try to like scam people to make a lot of money. Like there's way better ways to scam people than like charging $50 for a session and spending your time one-on-one with. That's actually like one of the worst ways to make a lot of money.
Yep.
So I don't think of them as scammers. I think they really believe in what they're doing. And I mean, you could argue if they're helping or hurting. Mm-hmm. Like I said, it's not the way that I practice. It's not really what I think. I think that like, a chiropractor, a traditional chiropractor, it's like, I think of it more like they're really just trying to make the human spine able to do everything that a human spine should be able to do. Like all the segments should be able to move in all of their full ranges of motion. The whole spine should be able to move as one structure in all of the different ways that it can move as one structure. And then like each individual motion segment should have a full expression of its anatomically available motion. Mm-hmm. And then there's all these different techniques within chiropractic. There's like techniques that, there's like a technique called the activator technique. There's a technique called,
is that the little gun?
Pop. Yeah. So there's an activator, it's almost like a staple gun where it basically puts this very short, very intense impulse through your body, which I'm guessing like it must be stimulating like Pacinian corpuscles and like Golgi tendon organs. And it's like putting this quick little stimulus into your nervous system that's like having, I mean, I guess I haven't taken their stuff, but my guess is that the way they would describe it is like they're putting a perturbation into the nervous system and then getting some sort of reflex from stimulating those nerves. Yeah, there's all sorts of different techniques. The one that they taught at Western States, they just called it diversified technique, which basically means we're just going to use all of the best ways to manipulate a spine. And it's sort of like an eclectic approach, if you will.
Oh, shout out Erson.
If you're familiar with the term eclectic.
And then the other thing too, I've seen a lot in chiropractic is the whole, this like body scanner for energy, like side to side of the body.
Yeah. I'm not that familiar with that, but I think it's like, I don't know if it's like a heat. They're looking at the heat and the blood flow. And the idea would be like, if you like if you have some sort of involuntary muscle contraction and it's clamping down on some of the blood vessels, that you would be able to look at the actual heat and then be like, oh, there's something weird going on this side. Like, I mean, if I could take something that measures heat and I can see that there's a heat difference side to side, I mean, that's kind of weird. Like, why is there more heat on this side than this side? And then if I manipulate your spine and I stretch the joint capsule and I put this big shocking stimulus into your nervous system, and then there's more heat. I mean,
interesting.
That's kind of weird. That's kind of weird. There's something, I mean, I don't know if it's, I mean, everything's energy, right? Einstein showed us that E equals MC squared.
Yep.
So
yeah, the thing is, and the big thing in the PT profession, almost to a fault, is everything is evidence-based.
Yeah, which assumes everything has been studied
and proven to be right, which I think
nothing's been.
Yeah. Go ahead.
Like what percent of things that could be proven right have been proven right?
Exactly.
And then if you're going to criticize everything that does not have a definitive study, you're not going to know what the hell to do. Because we don't really know as much as people want to. Like, everybody wants to think that we know everything because it makes you feel safe. It makes you feel knowledgeable. But I mean, the human body's super weird. Have you ever seen one of those animated videos where you see like what's happening with like actin and myosin and like all the little molecular robots in the human body?
No.
Oh my God, dude, you got to watch one of those.
Okay.
I'll send you a link. There's like these videos on YouTube where it shows like all of the different molecular like not all of them, but like certain molecular structures in the body represented, like what they would look like if we could zoom in and put a video camera. And it's like, okay, so your body is like made up of trillions of little chemical robots, just automated processes. Like, that is really strange. How much do we really know when there's like hundreds of billions or trillions of these molecules that are just running around inside of your body doing all of these things that you don't even know is happening?
Yeah.
But we want to act like a couple randomized controlled trials tell us that we know how to treat everybody's problems. It's ridiculous. Yeah.
I was even thinking the other day, like, so we do shockwave therapy now in our clinic, and like even 2 years ago, people were laughing at it. So, like, I got PT students telling me it's a placebo machine and this and that. And before that, it was pain science was everything, and don't put your hands on patients, and it was dry needling is bad. And now it's like, now dry needling and manual therapy are in the clinical practice guidelines of like something we should do. And now,
oh really?
Yeah. Now there's hilarious. There's a ton of evidence showing like shockwave is very effective. And I see more and more clinics rapidly getting these devices to improve patient outcomes. And it's like, I was always doing these things, even though like they weren't evidence-based, I saw them working.
Exactly.
Now in Chiro school, do you guys is there like a federal board exam everyone has to take?
Yeah, there's a national board exam. So all of the schools have to prepare for the national boards. So and that's in a variety of different things: radiology, diagnosis, biochemistry. So there's like, legitimate hard sciences that you have to pass. I went to the University of Washington and studied business, which is like a very challenging program to get into. And then I went to the University of Western States, and chiropractic schools are not like as competitive to get into as physical therapy schools.
Sorry.
And I didn't apply to physical. I only applied to the University of Western States, by the way. And it was legitimately very intense. It is not a joke program. It was very challenging and very legitimate, I would say. And that's one of the criticisms that kind of like makes me a little bit upset, is like people think that a chiropractic program is not like a legitimate field of study. It is definitely a legitimate field of study. There is no doubt. Chiropractors have probably like the best knowledge of how the joints of the human spine are structured and how they move. And they have incredible hands-on skills. I remember I went to a McKenzie C course, which was like cervical spine, I think.
Yeah.
And I went to the physical therapy one because they have a chiropractic one.
Oh, really?
So that chiropractors can get continuing education credits, and then they have the physical therapy one. And I just went to one of the physical therapy ones because I wanted to take it. I didn't care about the credits. And I remember being like, my head was in the hands of these physical therapists, and I was like, oh my God, you guys are terrible at this. Like, even the worst classmate of mine from chiropractic school was light years ahead of handling my head and neck. And I worked on the I think I was paired up with the instructor for one of the moves, and she was like, 2 seconds after I grabbed her head, she was like, oh, you're the chiropractor. I was like, how do you know that? She's like, because I feel like my head is comfortable in your hands. So chiropractors have great manual skills. There's no doubt about that.
Yeah. And I think, I think that might be a big difference of like physical therapy is so broad in what we do we're in so many different settings. So like people think a lot of times is PT of, oh, I go here when I hurt my knee or I have surgery and this and that. But it's like, we're in inpatient, we're dealing with strokes, traumatic brain injuries, pediatrics, geriatrics, cardiovascular issues, cardiopulmonary issues. We do musculoskeletal stuff. But like in school, I only got, I think I had one like 3-hour lab on exercise, which I ended up teaching because the professor knew like the spine course specifically. I ended up teaching. She's like, or at least a vast majority of the lab section. She's like, you do strength and conditioning, like you know how to coach these things better than I can. And I was like, cool, glad I'm here paying for me to teach for free.
Wow, that's crazy.
And then as far as manual goes, like we had, I think, one lab that touched on the 3 different types of massage, and we don't touch manipulations, and we did mobilizations, a few weeks at a time, depending on what lab we're in. So we don't really get a ton of hands-on training.
Yeah, we had a ton of hands-on training. I mean, so much hands-on training. And like at my school, we had a dissection lab. Like, I don't know if you guys dissected.
We did cadavers, yeah.
Yeah, there was 5 or 6 of us to each cadaver, and we each got a cadaver undissected, and we spent 9 months as a group of 5 dissecting the entire thing. I don't know. Did you guys do that?
Yeah, we did.
Yeah, not a lot of programs do that.
No.
I'm surprised, actually.
They discontinued it, I think, 2 years ago at UMass Lowell.
What a shame.
I know.
That's like, that was worth the price of tuition, I would say. To have the opportunity to dissect an entire human body was worth the price of tuition for the entire program, in my opinion.
It was very cool to do. I will say
that's like a once in a lifetime experience.
Yeah.
I mean, that's an incredible experience.
Absolutely.
But yeah, the manual skills of chiropractors are super good. And something interesting too, like when people were saying, when people are saying that like manual, the pain science, like, oh, manual therapy is so stupid. Anybody who does that is an idiot. It's like, think about this. And I mean, it sounds like you had a similar experience to me where it's like, hey, I'm doing this stuff and like, I see people feeling better. So what the hell are you talking about? Like, imagine somebody has shoulder pain and their shoulder has been hurting for 2 years. Like, let's say they've just, every time they raise their arm up overhead, there's kind of this chronic shoulder pain. And so what has that person done in their own mind? It's like they think of their shoulder as this thing that hurts. And then they get a massage, or they get like a needling, or they get ISTM, or they get a mobilization, or some hands-on type stuff, pin and stretch, whatever. And it feels good. So maybe that's the first time in 2 years that joint has felt good.
Sorry for the technical difficulties. Ryan's internet just decided to shut off. So as you were saying, Ryan, so the last thing I got was, so someone's shoulder hurts. They've been having shoulder pain. You're rubbing the shoulder and it feels good. Where were we going from there?
Yeah. You do some sort of technique on their shoulder and it feels good. And maybe that's the first time their shoulder has felt good in like the 2 years.
Mm-hmm.
And so it's like, are we saying, and like, do you need a study for some, do you need a study when you're literally working on someone and they go, oh my God, that feels good. It's like, okay, well, you just gave a person, you just reassociated that to them, that their shoulder can feel good.
And they have a little hope now.
Right. They have hope. And now it's like, wait, it doesn't have to hurt, you know? And like, oh, but there's no study to show that manual therapy is effective. Okay, well, this person who just told me their shoulder always hurts just had this moment where they're like, whoa, it feels so good. What the heck?
Mm-hmm.
I mean, we're just going to discount that, you know? Like, I always thought that was absurd. Like, I remember this one time, this girl came in, she came in with her husband, and she had like tweaked her neck, and she was like, oh, I can't even bend my neck, you know? And I did like 5 minutes of like super light ISTM on her neck. And she moved her head like side to side and was like, oh my gosh, I can't believe how much better it feels from just that. And the guy, the husband, he turns to me and he goes, thank you, dude.
Yeah.
It's like, okay.
Save the marriage.
Do we need well, they're divorced now, but, I delayed a divorce.
Yeah.
But like, do I need a study? It's like, well, hey lady, I don't believe you because there's no randomized controlled trial. So you're full of shit. You're lying to me. Like,
yeah.
Come on. No. And then it's like, and then, you know, after you do that, and then somebody has like the ability to like, okay, yeah. So if I move it around, and then now they're starting to move their body more, they're not scared of it. They don't think it has to hurt. They have, like you said, oh, there's like a glimmer of hope here. Like it could feel different.
Yeah.
And to me, it's like, that's a lot of what manual therapy is doing, is breaking this cycle and showing somebody experientially that it can feel different. Because like another thing with the pain science thing, it's like, oh, it's all just nociception, and nociception's not bad. It just goes to your brain and it gets processed, blah, blah, blah. And it's like, okay, well, I tweaked my neck and it hurts like hell. And knowing that does not help me. It still hurts really bad, even though I know that. What else do you have to offer me? Nothing.
Yeah. Just, we'll
cool.
talk it out.
I'm going to go to the guy down the street who's like, yeah, I'll rub your neck.
Yep. Absolutely. And now I think part of this too is the whole narrative thing though, that does matter to patients and what we're doing. So, you know, there's that, philosophical side of chiropractic where people are going in. And I think a lot of people identify a chiropractor as somewhere where you go in, you might get a heat pack or stim for a few minutes, and then snap, snap, snap. I want to see you 3 times a week for the next 3 months, and then 2 times a week for that. And then let's get you on this maintenance package for another year. And then there's
a lot of that.
Yeah. And so there's that. The other thing I've seen too is, like I had a girl, she was a power lifter and she was like top 10 in the country. She was doing great. We had a competition. She had some like wrist pain come on, and she went on Groupon and found a thing for a chiropractor, went in, and he gave her the whole, and like, this was local wrist pain, like from being stuck in like a low bar back squat and full extension with a ton of weight. And,
a clear mechanism of injury directly to the wrist.
Yeah. And, like I screened her cervical spine, like nothing else was really wrong. I was like, all right, like after this meet, we need to take some time to rest. And she went to this guy and he was like, well, look at this picture of your spine versus a normal spine and like how out of place it is. And then he went all the way down to her pelvis and you have too much curvature, and she quit powerlifting. Like I couldn't talk her out of it. And he wanted to sell her on this like $5,000 a year package to make her human again. So what are your thoughts on shit like that?
Well, how long ago was this?
This was 2019.
And have you talked to her recently?
I have not, no, but
I'd be curious like how she's doing.
Yeah,
Did she do it? Did she do it?
I'm not sure because she just very quickly was like, she was like scared to power lift. and lift weights.
I don't want to defend that. I actually always despised that.
Okay. Why?
Because I don't think it's necessary.
Mm-hmm.
I would tell people, okay, do this and like come back in 2 weeks.
Mm-hmm.
You know?
Yep.
The whole like come back 3 times a week for blah, blah, blah. I am not going to defend that.
Yeah. And so. I think it becomes this, I think the problem too is like I will manipulate, I'll join it, I'll do all these modalities, but I'm going to make sure as hell that I'm giving someone exercises or teaching them about their ergonomics, their desk setup, their car setup, their sleep positions, you know, their activity levels, their exercise program, and give them something to do to, even if I do manipulate, I'm going to do something to keep that window of opportunity or window of change open versus, hey, you need to come back to me 3 times this week so I can put your joint in. And that's another thing I want to talk about is putting the joint back into place.
Yeah, that's obviously bullshit.
Okay.
Yeah.
So,
I think that's that's one of those things that like, I think a lot of people will be like, well, it's not really what we mean. It just makes it easier for people to understand. And it's like,
that's horrible.
And that's, it's like, well, that explaining it to somebody because you think they're too stupid to understand what's actually happening is either you don't understand it well enough to explain it simply in a way that gives them a more accurate understanding of what is actually happening.
Mm-hmm.
You know, it's like people that like when they do soft tissue work, they're like, well, we're breaking up the adhesions or whatever. It's like, okay,
no,
look, I will tell you this. Last year, or no, it was this year, I put together this document. I did like a very thorough research. I did a very thorough review of the research on ISTM and soft tissue techniques to be like, what studies are out there and what do they really say, you know?
Mm-hmm.
And I didn't find one study that said like we're breaking up adhesions, right? And then we're releasing something, right? Release. Mm-hmm. And it's like, well, we just say that because it's easier to understand. And it's like, well, but then you're creating a misunderstanding in somebody. And then and now they understand their body worse.
Mm-hmm.
Now they have incorrect understanding of how the human body works, and that is a disservice. Take the extra 2 minutes and explain it to them the right way so they have an accurate understanding of what we think is happening.
Yeah,
and
absolutely.
So I want, I'm not going to defend the joint. We're putting the joint back in place. Then that makes somebody think that if they do anything, the joint's going to get out of place, and then they have to go back, and now they're dependent. And I think that's a very fair criticism of the chiropractic profession, that they create this dependency on you need me to put your joint back in place because it's going out of place, and I know how to put it back in, and you don't. So, you're going to have to come in 3 times a week for me to do that. Mm-hmm. That's bad.
And Erson said this before too. If we really look at the forces we put into manipulating a spine, right? And cervical spine is a great example. Probably the least force you need, much less than the lumbar spine or thoracic to manipulate it in most cases. And so, if I can take my hands and just go and put your joints back into place, right? Let's look at football. How many hit, like, even though it's not intentional these days, like how much force is going through someone's neck, and we don't just see their spine falling out, or even like running. Like there was so much more force with ground reaction forces when you land going through your spine that those forces, like you would be like just on the ground in pieces and shambles if those forces were to just let your spine go in and out like that. Certain cases, like if someone has like a fracture or something, yes, maybe, but even then can be,
There's more than enough arguments. There's more than enough evidence and ways to logically argue away that explanation of what's happening in the body.
Yeah.
It's at this point, I think it's like willful ignorance.
Yeah. And then,
You know, like I'm a chiropractor. I've been doing this for 20 years. And so if I admit that that's not how it works, how do I explain my last 20 years of my professional life? And so people can't deal with that, right? A professional can't deal with that. It's like the people who say like, you can only, you know, if you bend your spine when you're doing this exercise, or you can only squat with your feet directly forward or whatever. And they've been saying, and they write a book. Well, I mean, it's professional suicide to them if they admit like, well, maybe I didn't fully understand what I was saying when I wrote the book.
Yeah.
Right. It's like,
Yeah, they're going to die on the hill.
like and like the irony is like everybody would respect that person more if they were like, hey, look, I thought that, and my thoughts and my opinions are continually being updated because I'm learning more. You know, like, and so I think it's the same thing with this, like, and this isn't just chiropractors, right? I mean, think about like all the,
oh, well, PT, the soft tissue thing with PT is the same of like, people come to me, they're like, oh, yeah, you need to push harder, like break up that scar tissue. I'm like, look, or people think scar tissue is bad. And it's like, someone told me I have all the scar tissue. It's like, okay. It's like, well, I tell people all the time, it's like, if you fell and you cut your elbow, that new skin is scar tissue. And that's stopping you from bleeding, stopping you from getting infections, like keeping your bones and joints together so they don't fall out. So like I have to re-educate people. So it's the same thing on the PT side of like, why are we telling these people these things and then like sticking to it just out of, like this bias that we've created for ourselves.
Yeah. I remember I went to like a soft tissue seminar, like a certification seminar. And like, I was having like lateral, at that time in my life, I was having like lateral knee pain that was preventing me from being able to run more than like 400 meters without knee pain. And I remember the main instructor was like palpating my knee and was like, oh yeah, your meniscus is stuck, you know, to this thing. And I was like, oh, weird, you know? And then he works on it. He's like, yeah, it's unstuck now. Now it's gliding and it's sliding and it, you know? So I went at lunch and went running on a treadmill and I was like,
still hurts.
It still hurts. What the hell are you talking about? And you know what made it better was changing my running technique.
Yeah.
So bullshit.
Yeah.
And that's like, and those people are teaching the professionals. And professionals go there and they get their little paper and they get their certificate. And then it's like, I learned from the best. And it's like, well, those best are also not being accurate.
Yeah.
Because they can't admit that what they're teaching is not actually reality. It's an opinion based on this idea that I can palpate all of these different sliding things.
And it's change.
Right. It's like, no, it's like, unless you like have like 1,000 times palpated the thing and then like dissected it open to like confirm what you're feeling, it's guesswork.
Yep. Absolutely.
It's guesswork. I mean, you can feel obviously like if a joint is not moving.
Yes.
You know, like if somebody's neck is like literally not bending.
And you can measure that.
Right, you can measure it, but like, oh, I feel this scar tissue right here. There's this adhesion between your IT band and your vastus lateralis.
The data shows.
Shit, dude, you can't know that.
Yep.
You can't know that. And it's like, okay, well, how many times have you verified that? How many times have you felt something that you thought was scar tissue and then actually went and verified that it was scar tissue that you're feeling? Zero.
Yeah. And
zero.
The research shows that like our palpation skills are very non-reliable for things like finding a trigger point or measuring change in tissue over time. Like it doesn't really happen.
Yeah. I mean, you can obviously feel real anatomical structures. Like you could put your hand on the inside of your arm, like right here, and you can feel nerves. I mean, you can feel the nerves. You can feel the nerves in the axillae. You can feel the nerves on like the posterior aspect of your fibula. You can feel a lot of things, but let's not pretend like we have these MRI hands, okay?
Or that we don't have bias.
Right, that like, it's delusion.
Yep.
There's a lot of people deluding themselves. That's for sure.
Another And so this was actually an interesting case that came up so we talked about, and I think so the word adjustment to me is like a misleading term versus like,
I don't like the term. But why do you think it's misleading?
I think it's misleading because that kind of says, when I hear adjustment, I think, and I thought this before I went to school for all this, because I used to see a chiropractor, because I had back pain for years, and I went to a chiropractor for years, and it never got better. But it was the old school, like, 3 times a week, come in, we'll do this, and then see you later.
Flying 7.
Yeah.
You probably got the flying 7, which is like cervical rotation,
Thoracic.
lumbar, thoracic.
Yep.
That's 1, 2, 3, 4, 5. There's 2 more. I forget what they are.
Yeah.
I don't do it.
But that being said, the adjustment is like, when I hear that, it's like, oh yeah, you're out of place. Now I put you in alignment. I put you back into place. All this, when a lot of the, when you hear manipulation, it's like, oh, I manipulated somehow, just like I manipulated a tool. I manipulated this. I used to use this to my advantage. It's like, okay, I took something. And so like, I think it's just misleading and someone thinking I need to go to this person to be put they need to adjust me into this unicorn state of alignment.
Yeah. And I think that it's important to note, like, what is it? Grade 1 through 4 is mobilizations, and a grade 5 is a manipulation. And it's literally, a manipulation is literally like a scientific term for how a joint is moved. Mm-hmm. Right?
Yep.
And so it's like, it's not like a soft term. There's like a clear definition of what a joint manipulation is. And I don't think people understand, a lot of people understand that, like, what the difference is between a joint mobilization and a joint manipulation. And it's like, mobilizations are slower, they're deeper, depending on the grade. And then a manipulation is literally moving a joint at a certain, like, at a very fast speed, in like a short depth, to, at least in the chiropractic, at least from my understanding, to basically quickly separate the joint surfaces and cavitate the joint. Mm-hmm. And that's like what creates the popping sound, is the joint cavitation. And it's like, that's what a joint manipulation is. Mm-hmm. And an adjustment is like a softer term. Like, it's not as clearly defined. And like, that's where I think that the professions really help each other. Because PTs would not be doing manipulation if it wasn't for chiropractors doing it and getting results that you guys weren't getting.
Fair. Very fair.
You guys are manipulating because people come to you and say, well, I went to a chiropractor and they adjusted my neck and it felt better. And then your whole profession's like, well, shit, we better compete. It's like a duopoly, like chiropractors versus physical therapists in the United States. It's like a duopoly of professions. Mm-hmm. And whenever you have competition, you always get better outcomes. So it's like the two professions are like two swords sharpening each other. I like to think of it like that.
Yeah. And so,
and more chiropractors are doing a lot of things that physical therapists are doing. Cause it's like, okay, we see that there's benefit in what you're doing. And so that's why it's like, why would I hate on the other profession when I could be learning the best parts of what this group of people that's approaching it from a different way of thinking with different techniques? It's to the benefit of my patients that I learn the best things that everybody's doing.
Yep. Now,
if I'm like, chiropractor's bad, physical therapy good, it's like, well, I don't want to do joint manipulation. That's chiropractic. Instead of being like, hey, they're just people trying to solve similar problems that I'm trying to solve. And they're doing things I'm not doing, and they're getting results from doing those things that I'm not necessarily getting. So why don't I learn from them? But if it's a tribal warfare, you're not going to do that.
Yeah.
And that's why I don't like the definition thing.
Yeah. And, and again, like, I have you on here as a chiro, or you went to chiropractic school. I won't call you a chiro since you don't identify as one, but I've taken courses with chiropractors. I have friends that are chiropractors. Like, we can all learn from one another, but It was funny. I actually put up a video of me doing a manipulation on social media the other day. And 3 weeks before this local chiropractor had reached out, and I don't think he knew I manipulated, but he's an older gentleman, and he was like, he messaged me. He's like, "Hey, I've been practiced for 30 years. Like, we should meet up. I think we can help each other because I own a gym too." So he's like, and then 3 weeks later, he saw me post I did a CT junction manipulation, and he said,
"What was the setup?"
It was a seated CT. It's the Urson one, actually, the Bruce Lee that Urson teaches. So it's a seated CT junction rotation manipulation.
And you're standing behind or in front of the patient?
Kind of to the side of them. So you come over the top of them, and then you block T1, and then you hold their head, distract, side bend, rotate, and pop.
It's a pull or a push? It's
a rotation.
But is the force pulling or you're pushing it? Or both? So you're going to side bend, distract, and then rotate the head. But the hand that's rotating the head, are you pushing it into rotation or you're pulling it?
I'm pulling it.
Okay, so it's a seated CT pull.
Yeah.
Okay.
Sure. If you want to label it that way.
Chiropractors have like a million names for how to do all these different things. It's like very intricate, actually.
Yeah. So he messaged me. He's like, "What do you think you're doing?" I was like, "It's a CT junction rotation manipulation." And he's like, "But do you actually know what you're doing?" I was like, "Yeah, I just told you." And then he's like, "Well, what x-rays do you have to justify that care?" And I was like,
Jesus.
"Do you know my patient? Because I do." And I was like, "Why do you think I need x-rays to justify this?" I go, "Maybe I do have x-rays to justify this, but why do you think I need them?" Yeah. And he said, he threatened my license. He's like, "You should take that down. Like, this could be bad for your license, this and that. Like, you don't know what you're doing at that level of the spine. You need to know what you're doing, blah, blah, blah." And I was like, "I respectfully disagree with you. And here's research from your own organization showing that x-ray is actually more harmful to the patient unless it's really indicated."
Yeah. And like, why do you need an x-ray to move a joint?
Yeah, all I can see is bones.
Because that's what a manipulation is, right? A manipulation is you're just moving bones, right? Like you need don't get out of bed unless you have an x-ray, because like every time you move your own body, you're moving your joints. So maybe you shouldn't move your own joints by contracting your muscles. You know?
Yeah. Or don't
People are so you're licensed.
Yeah. And then it's like, there's actually
jail.
The course I just took, they showed a study where there's actually because and the concern is like you're worried about the vertebral and carotid artery, but there was a study they did that
for a CT.
Yeah, no, but there's even a study they did showing just like passive cervical rotation had 9 times more joint force than the actual manipulation itself.
Yeah, there's a lot of misunderstanding about. And again, that's like just misunderstanding of like what is actually happening in the body. Like when you position the neck in these different orientations, like do people really know like where the stress is going and how that, like, I think there's like more strokes in people who go to a hairdresser and like rest their head up like this while they get their hair washed.
That sleeping. Being like a belly sleeper, having your head inside side rotation, and then walking on a treadmill or going. I think there's higher rates going to your doctor's office too for like a regular primary care, like your annual physical. You have a higher risk of stroke there.
Well, I remember this one professor of mine, a professor that was a clinician that I really respected, and he said this. He said one time, like there was a patient in the waiting room. And he was running behind, because people show up late and whatever. So you might get behind by the end of the day. And the person had a stroke in the waiting room. And he was like,
shit.
If I had been on time, they would have blamed me. But they were in the process of having that stroke, which is why they had symptoms, which is why they came. And because I was late, they had the stroke in the waiting room instead of in the treatment room. Mm-hmm. And it's like, you have to understand that, like, and that, I mean, that's obviously why people would have that going to the medical doctor, because more people go to medical doctors than chiropractors. Mm-hmm. And so more people are going to have strokes waiting at a medical doctor than at a chiropractor, just by sheer absolute numbers.
Mm-hmm. Now, another interesting fact that was in this, and I've seen these facts before from other people too, but the incidence of adverse events is much higher with manipulation from chiropractors than PTs. Now, what I don't know is that just because chiropractors do so much more manipulation than most PTs do? I don't know how they like normalize the data for that or anything.
Yeah, like, is that an absolute number or a relative number? I mean, I'm sure it's higher absolutely.
Yeah.
Than relatively.
But if you did look at like a 1-to-1, who's going to have, but I do, my question leading up to that is, do you think too many chiros kind of try to jam a square peg in a round hole with manipulation?
Not without a doubt.
Okay.
Without a doubt, the first line is like, I mean, it's like the classic problem with every profession. And again, this goes back to why I didn't like identifying as a chiropractor. It would be like, I have a new patient. I have no idea what I'm going to do with this patient. Mm-hmm. Versus, I'm a chiropractor, so I manipulate. So whatever's going on, I just have to, right? It's just, that's stupid. It's dumb. Like, why would because I studied this program, no matter what happens, somebody's going to get this as the treatment. That's the stupidest possible way of approaching patient care, period. Because my profession does this, no matter what your problem is, I'm going to figure out which joint needs to be manipulated. That is stupid. Mm-hmm. That is so dumb. Why would we assume that every problem is because a joint manipulation is needed? That is absolutely not true. And so,
but people are doing it.
Of course they're doing it. And just how many unnecessary surgeries there are, how many prescriptions there are. I mean, there's a ton of, look, there's a lot of stupid, incompetent people in positions of authority in the medical system in the world. You know, and like, just because somebody has a degree and a license doesn't mean anything.
No.
It doesn't mean anything, because they could be a moron. Nope. And you could have a surgeon that's a moron. You have lawyers that are idiots, but you also have super smart people in every field, right? You have chiropractors like Craig Liebenson. I mean, you think Craig Liebenson's just, no matter who comes to him, he's just cracking their neck? Give me a break. Dude, that guy's like very, very smart.
Yes.
He has a huge range of skills. And he's a chiropractor, right? And then you have a chiropractor who's like, no matter what they do, I come in, I give them the flying 7.
Yeah.
And they're both chiropractors. And then you have a surgeon who does, my ex was a operating room nurse. Mm-hmm. And she told me a story where like they did an operation on a patient. They did an operation on the wrong eyeball.
Fuck.
Right? So a surgeon did an operation on the person's wrong eyeball.
Not good.
So every profession has great people and every profession has idiots.
Yep.
And I think that's really important for people to understand. And that's why it's like a reputation as a professional is so important.
Yeah.
Because the reason I went to chiropractic school instead of physical therapy school is because when I was having a certain problem, like I went to a physical therapist and I was like, this guy sucks.
Yep.
Like everything he did, it was like, are you even listening to what I'm saying and like what I'm telling you? Because it sounds like you're just giving me the same thing you would give to anybody who had a problem with their knee.
Yeah. And
you know, like
exactly.
And I went to multiple physical therapists for this knee thing that I was having. Mm-hmm. And I did a video gait analysis and I went to this orthopedic surgeon who is the medical doctor for a professional baseball team. And okay, you'll like this. You'll like this story. Professional medical sports medicine doctor for a professional sports team. And I have this knee pain I was telling you about of unknown origin. Mm-hmm. I got MRI, I got orthopedic tests. Nobody knew what it was. And he was like, well, I think maybe we need to do exploratory surgery to go in there and see. And I was like, no way am I doing that, right? And I went to physical therapists, and I went to a chiropractor who like did hands-on manual therapy, working on my hip extension, working on like the tissues around my knee, and I think even like my foot. And I was able to run without knee pain. And I was like, oh my God. Mm-hmm. I have been for years trying to figure this out. And this lady, after 2 or 3 sessions of doing like soft tissue work and just like getting my joints to, I don't even know exactly what was like the reason.
Yeah.
And I was like, I'm going to chiropractic school, because she's a chiropractor and everybody else couldn't even figure out any actual explanation for what was going on. And I go to this lady, and now I can run with no problem.
Yeah.
And then I go back to that medical doctor for like a physical, and I was like, oh, by the way, like my knee is better. He's like, oh, really? And I'm like, yeah, dude, I had like this, I went to this chiropractor and she did all this stuff, and like now it's fine. He didn't even want to know what happened. And it's like, as a professional, a case where you're like, we should do exploratory surgery. The patient comes back and says it's better now, because shouldn't you be curious what happened? I mean,
yeah.
And so it's like, okay, we can argue about if chiropractors are doing stupid things or physical therapists. It's happening in every profession. This guy didn't even want to, he wasn't even curious. He didn't care.
No.
He didn't care. He was ready to just retire. He didn't actually care about helping me. He was like, I don't know, I just got to have a full patient log. I got to get this done.
Yep.
So it doesn't matter what the profession is. I mean, humans are just, it's a bell curve like everything. You have capable and incompetent people in every profession.
Yeah. I actually I had a really complex case. He's actually a good friend of mine now, but he was having this like weird burning, like anterior hip sensation, like in like TFL. But it had kind of started as like a labral symptom and then changed over time. And then he was having all these weird symptoms. Like it would only happen when he was striving. And then it was, if he was doing weighted pull-ups with like a weight belt around his vest, like the distraction of like his pelvis would cause these like referral symptoms into his hip. But like he could run and he was fine. It was weird. But like laying on his back would cause him a lot of pain. And so I was like, it seems like something with maybe the back, something, or pelvic floor, nerves, I don't know. So, but he was in a traumatic car. He was hit by a car when he was like 13, and he had like an external fixator. He's got leg length discrepancy, Anyways, I thought he might have hip dysplasia. So we go to Boston Children's, which is the world-renowned center for hip dysplasia. And so there's like 2 doctors that are supposed to be world-renowned at it. And they're both at Boston Children's. So we go in, we meet with the surgeon, and I give him this big like write-up of like, here's all the things that don't make sense about his case. Like it's not just FAI or, impingement syndrome.
Yeah.
And he's like, okay. It's like, well, let's send you for imaging. Goes back, he does an x-ray, comes back. He's like, yeah, I don't see anything with your back, but you have this little cam lesion here. So we can schedule that surgery for Monday if you want. And I was like, time out. Like, what about all the other symptoms? Like, if it's FAI, his hip would hurt when he flexes it and lying on his back, not just laying with his legs straight. Like, you're not impinging the joint there. Like, how do we explain that? Or when you're doing pull-ups that your hip hurts. Like, well, what is that? He's like, maybe we should do some more investigation. So they send him to sports med. They do all the ultrasound guided injections to see if like the anesthetic cures it, whatever. No findings there. They can't figure it out. So then they just decide, let's just do the surgery anyways. Like 5 months later, this patient still has pain. And it's like,
Yeah,
man,
there's countless. There's like countless stories. I have two stories I want to share with you if you're interested.
oh, yep, let's go.
There was this one gal. She was probably like, I don't know, 50. CrossFit lady. I think she like fell. She was like at the gym and fell and like, I don't know, maybe hit like a dumbbell or something. Was having this like thoracic pain. And I was like palpating and pressing, on the different, like over like where the rib articulates with the spine, basically, And she had these like this one part, like I pressed and she was like, and I'm like, okay, that's weird. And so I told her to get x-rays. So I sent her to get thoracic x-rays. And this is actually a super important lesson for clinicians listening to this. Yeah. So I get the x-rays. So she gets the x-rays, she brings it back and brings back the report, right? And I read the report and, well, actually, I don't know if I ordered the x-rays or if she came with the x-rays. Whatever, it doesn't matter. The point of the story is the same. And I read the report and no remarkable findings. And I was pressing on that thing and I'm like, that's weird. I got to see the x-rays, Like the report says it's fine. Mm-hmm. But that's so strange that it's that painful, Mm-hmm. So I look at the x-rays. I just like put a white, I don't have like an x-ray box so I just turn like a white screen on my computer and like hold it up, and look at it. And I was staring at this and I was like, I remember I stared at that x-ray for 10 minutes and I was like, the report says there's nothing, but this really looks like a transverse process fracture.
Nice.
And like a very obvious fracture of the transverse process. And I didn't do any treatment to her. And I was like, look, I'm not like a radiologist. I'm not like looking at x-rays all day, but I swear to God, you have a fracture of your transverse process. You need to go back to like because I think like it was her family doctor or something that like got ordered the x-rays or the radiologist. I was like, take these and go back and ask them. And so she emails me like the next day. She's like, yeah, he says, thanks for identifying the fracture that they missed. So the point is, don't just read the reports, Yeah. If I would have just read the report, maybe I would have been like, yeah, I'm going to like mobilize the joint that's painful. No, it was a fracture transverse process that the standard, and we all think radiologists are like these gods, that they can like, it's a radiologist, They missed a transverse process fracture that was exactly where the complaint was.
Yep.
Like right where it was hurting, right there, like the TP was like,
yep.
Crazy. And then this other one, this lady had she was having hip pain, like kind of anterior hip pain, sort of vague hip pain. She was also a CrossFitter. And she had recently had a surgical procedure to like remove, I don't know if it was like her appendix or something. Mm-hmm. And when I was examining her hip, nothing made sense. Like what, it's like I would take her into hip flexion, no symptoms. I would pull on it this way, contract, poke, pull, contract. I could not replicate her symptoms. I was like, this is so strange that you have these hip symptoms and I am like unable to mechanically in any way recreate them. Mm-hmm. Right? Because if somebody has an impingement, if you jam the joint, it should hurt, right?
Yeah.
And I told her, I was like, I think you should like, maybe something happened in your surgery where like they had your leg in a weird position and like I was like, but I don't think there's anything that I can do for you because I literally don't know what the hell is going on. Mm-hmm. So she goes back to the surgeon and asks like, did something happen during the surgery that like might cause this? No. And they're like, oh, I think you have a disc herniation.
No,
is what they told her. And she came back. I was like, you do not have a disc herniation. Like you have no radicular
symptoms. Yeah.
You do not have what a radicular symptom looks like. No nerve tension tests are recreating it. No spinal tests are recreating it. And I was like, go back like to your orthopedist and like have them like investigate this, because this is like outside of like my scope, are like these unexplained non-mechanical symptoms, right? So she goes back and then, I don't know, disappears from my care, right? And then a year later, I get a Facebook invite to her funeral.
No.
She had a metastatic lesion in her hip.
Wow.
So she was literally having those symptoms because there was like a cancer eating the femoral head.
Damn.
And they were telling her it was a disc herniation.
Mm-hmm. That's crazy.
It's like, yeah, man. So it's like, you just don't, yeah, that one really stuck with me because it was like, oh, she died.
Yeah. And
that's where it's like, that's why it's like, you can't just assume that because you're a physical therapist or you're a chiropractor, that the answer is rehab, or the answer is manipulation, or the answer is needling, or the answer is shockwave, because maybe that person has a metastatic lesion.
Mm-hmm.
Maybe that person has a fracture.
Yep.
But if you're looking at it like, I'm a professional who does this type of treatment, you've already blinded yourself to reality.
Yeah.
And we should be impartial to our techniques that we're trained. And we should look at the human body as like, this is a mystery right now that I don't know what's going on. And I have to figure that out before I do any treatment. And I have a range of treatments that I perform that are within my scope. And if it's not within my scope, I'm going to refer you to professionals who deal more with those things.
Mm-hmm. Why is it too, like, that so many chiros just manipulate? Like, you guys go to school for, I think, 3 years, just like PTs do. And it's like, why do so many chiros just want to manipulate?
Well, I'll tell you something about the state of Washington, for example. When I was like still in network, they started to make it, I had to get pre-approval for any non-manipulative techniques.
Okay.
So if I manipulated as a treatment, I didn't need pre-approval from the insurance company. I would do the treatment, they would pay. Mm-hmm. If I wanted to do exercise or manual therapy, I had to get approval from the insurance company and go through that bureaucratic bullshit.
So just easier.
It's just easier. So it's like, that was one of the things that like just made me just nuts, was like, you are through the policies essentially dictating the treatment choice. And that is like, to me, it's extremely unethical.
100%.
So it's like you're making it harder for me to do the treatment that I'm using my judgment to do. Mm-hmm. And I have to go through these extra steps, and then I have to do that every 5 sessions, like all these, and it's different from every company. So like, I think part of it is that is like, it's just easier like process wise. I think it's also just kind of like the business model that a lot of chiropractors have, where it's like, well, I do 10-minute sessions. So that means you come in, I ask you, brief session history. How did things go since last appointment? Boom, 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 you're out. I think part of it is patience. I had one patient once that she wanted me to like adjust her, she asked me to like adjust her like hiatal hernia or something. I had this chiropractor who I pushed my stomach up through my diaphragm, and I was like, look, I had literally said this. I was like, let's just end this appointment right now.
It's like a bad
I'm not gonna charge you anything, but I'm not the person for you, okay? Because that person was looking for somebody to do that. Mm-hmm. And I think a lot of people go to chiropractors to get manipulations.
Yeah, there's an expectation.
I want to go. It's like, dude, I just want you to crack my neck. What are you doing giving me exercise? Like, I'm coming to you, I'm paying you, crack my neck, and then let me out.
And it is easier. Like PT, they refer to us as the pain and torturers of.
Yeah, people go to PT with an expectation of like, I'm going to get exercise. They're going to like help me figure out how to do stuff.
Yep.
It's like, imagine if you went to a massage therapist, it's like, and they don't do a massage. It's like, hey, you're a massage therapist, right? And I'm paying you money and I'm asking you for a massage and you're not massaging me.
Yeah.
So there's a public expectation. Like, I go to the chiropractor does what chiropractors do.
Mm-hmm.
I think that's part of it. Like, I don't think people go to a chiropractor thinking the chiropractor is going to figure out a variety of things to do necessarily. And that's, I think, part of, like, as a provider, you have to like have your way of approaching things and then build a reputation. Cause, like, you know, I had a bunch of patients who are like, my friends told me to come here because you're like a chiropractor, but like, you're not a chiropractor.
Yeah.
Like, you're going to like figure out what I actually need. You know, I had so many people tell me that.
Yeah.
So people would come to me. That's why I didn't like getting non-referral patients. Mm-hmm. I saw you're a chiropractor on the internet. Can you adjust my hiatal hernia? No, I cannot. And I don't know how to do that. And I'm not going to try.
Yeah. Sounds like organ damage to me, on our part. And
I mean, and maybe that works. I don't know about visceral manipulation. It's not my specialty, but it's like,
visceral manipulation is pretty cool. I've had a couple of patients, not that I do it, but I have someone I refer to that practices that way. And it's like, I've had some weird things that didn't add up, and it works. And there was one person similar to you of mechanically could not reproduce this pain, saying this and that, but they didn't have any other underlying symptoms that would have pointed towards a cancer. So I was like, and she had some past like gut issues and stuff. So I sent her to this woman, and turns out she had like a tumor on her liver that was like cancerous, and they were able to like get in there early and intervene on it. But just interesting things that I would never know as a PT myself. But as far as that's, you know, people ask me all the time, like, well, should I go see a chiro for this? Or do you think a chiro would help this on top of PT? And I'm like, it's very hard for me to say, because like there's a lot of times we see so many patients that get hurt from chiropractic manipulation. And I've had a lot of people that really come in. It's a significant amount, not all the time, but like enough where
notable and enough where you've noted it.
Yeah. And a couple where people have gotten worse, and they'll tell me their story of like, I was having radiculopathy, I was doing this and that, and like they manipulated me and like it made it worse, and it's been worse for 6 months now. And
I've heard that. One of my good friends from college went to a chiropractor because he had back pain, and then he had like full blown radicular symptoms after getting a manipulation.
Yep. And it's just like, why are we doing all these things to people? How do we not see it? And like, manipulation is a tool I have that I use when I need to, but I'm not using it with everyone all the time. Like, and sometimes these patients come in, I'm like, I don't know why a chiro was manipulating you. Like, I wouldn't touch this with my 10-foot manipulation pole.
Yeah.
And even, I think I remember listening to one of your podcasts back in the day. Like, you said, like, your back hurt significantly from chiro school and just like being manipulated all the time.
Yeah, it was that. I was also training super hard and lifting as hard as I possibly could with like probably not great, technique and not great programming, mixed with sitting in chiro school all day, mixed with practicing tons of manipulation.
Yeah.
But the manipulation was, I think, definitely part of it. Just getting cranked on constantly.
Yeah. And it's like, it can be good. There's a therapeutic dose to that, just much like anything else. So,
it's a dose. It's a dose thing.
And then the other thing here is chiros can claim that manipulation will help with sinus issues, allergies, immune response, improving your immune response so you don't get sick as much, reproductive health, diabetes, I saw online, blood pressure. And then there's some other ones too of like, manipulating children like fresh out of childbirth and all that. Like, what is your view on all these? I'm going to say drastic claims here.
I mean, there's definitely people who have like, let's say they have not really moved their lumbar spine in a long time. Mm-hmm. And like they're holding a lot of tension, and then they kind of let go of that tension and they let somebody move those joints into positions they haven't been moved in. And then they get, a lumbar manipulation, and they get all of this novel stimulus. And then, I mean, it's a pretty common story. Chiropractors talk about this. Like those people will come back and be like, I was constipated and I my bowel movements have been like so much better.
Bowel movements is one I've seen too.
And it's like, it makes sense. I mean, you have all of these, what are they called? Like the
nerves.
Yeah, but like not the gang, is it gang? No, the
ganglia. Yeah.
Like the nerve, whatever. You have like a bunch of like nerve centers in front of your spine, like through the lumbar spine. And it's like, well, your nerves are connected to your spinal cord and they're attached to your intestines, and
yep.
It happens enough that people note it. For the immune, I feel like I've read a couple studies that showed that there was like an increased immune response after certain manipulations in the cervical spine.
Mm-hmm. Reach.
I think that's a challenging thing to. It's like, it's obvious if someone's like, I was constipated and I took a massive dump.
Mm-hmm. Yeah.
Dude, can I tell you a funny story that happened the other day?
Yeah, of course.
I was flying back to Seattle like 2 days ago, and I was in the airport lounge and they had a shower, and I was like, I'm gonna go take a shower at this lounge because it was like an overnight flight. And I go to the bathroom area and there's like a lady there kind of like managing the shower station, and I was like, can I use I was like, how do I, do I need to like just ask you, or like, what do I do to use the shower? She's like, well, what are you going to do in the shower? Like, are you going to take a dump? This lady, she's like 60. I'm saying I need to use the shower. And she's like, well, what for? Are you going to shower, or are you going to take a dump? I was like, what? I was like, what are you asking me? She's like, well, a lot of times people come here and they just go to the shower so they can take a dump. I was like, what are you talking about? And she's like, well, they don't want to go in the bathroom where there's like stalls, and they want to go in the private. So I go in there and there's a toilet in there. I was like, lady,
explain that.
I'm like a customer going into this lounge, and you asked me if I'm going to take a dump. She said the word dump. You asked me if I'm going to take a dump in the shower. Anyways, it made me think of that, talking about people getting their lumbar spine manipulated. There was no training on how to communicate for those people, I guess.
Yeah.
Seems inappropriate.
Yeah.
But that happens enough where it's like, okay, obviously there's a causation, but like potentially there's a correlation. But like, how do you know if somebody's immune system? You can cut that dump part out if you want.
No.
How do you know? How do you know if someone's immune system is stronger after getting a cervical manipulation? And I haven't read enough of the research to know if I believe that or think that there's evidence for that. So could it be possible? I mean, I've had times where I get my neck manipulated and it's like my entire world just got rocked.
Mm-hmm.
I don't know if that has some stimulatory effect on my immune system. I mean, sinuses kind of makes some sense, right? I mean, your sinus is like a space between bones.
Mm-hmm.
I don't know. I don't know if like you have a really stiff neck and then you get manipulated and everything moves differently and the pressures change. I mean, I don't know.
What about the diabetes though?
Diabetes makes no sense to me. I guess like, obviously it would be like the way that and this is where it's sort of like the philosophical chiropractic viewpoint might come in, where it's like, well, the pancreas is innervated. And if your spine is not moving appropriately and the nerves are therefore not functioning optimally, is there an effect on the pancreatic function when the spine moves better and then everything is moving better?
Yeah.
I mean, I understand like the basis of that argument. I don't know if it's actually true.
Would you tell someone that you're going to improve their diabetes from manipulation?
I would not ever say that unless there were like definitive studies showing that that was true. I think it's a reach. I think that there is an explanation of why it could work.
Possibly.
I mean, if we agree that there's nerves that go into the pancreas, and if we agree that nerves are real, and if we agree that the spine is real, and if we agree that the movement of the spine affects the nerves, then there's at least a basis to make that argument. Now, whether it actually does that, I don't know. But it's not like there's not at least some way to try to explain why that effect could be happening.
Yeah, that makes sense.
But I'm not going to like run ads on Facebook, like come fix your diabetes by getting manipulated. I remember during COVID, like the peak COVID, there were like chiropractors saying that like, get adjusted because it's better for your immune system. And right now with COVID, it's like really important. It's like, okay, can we please not say that right now?
Yep.
You know?
And then I have two more things I want to go over here. One is, what are your thoughts on posture, pain, and spinal alignment?
Yeah, that's a good one.
And so the one thing that was interesting, so we were talking about adjustments and spinal manipulation. The one thing, that course I was just at, actually there's three things I want to talk about. The instructor brought up, there was an interesting study they did on scoliosis and actually measured a measurable change in the scoliosis that people had in the curvature of their spine post manipulation, and like long-term outcome was improved. So it's like, we can move bones, but how often is that always happening? And like, what are we really doing? So I just wanted to throw that in there, complicate my question.
I think the whole posture doesn't matter is going to age the same way that pain science has aged.
Yep.
Because, okay, if I'm going to do nothing physically demanding with my body, posture doesn't matter. If I'm just going to lay in bed all day for the rest of my life, posture doesn't matter.
I'm going to disagree.
Okay. Why?
My brother actually came into me as a patient the other day because he couldn't move his head. And he goes, I don't know what I did. I didn't do anything the day before. I go, well, what did you do? He's like, I literally melted into my bed and watched football all day. I go, well, how are you sitting? Because I was laying on my back with my head completely turned to the right, just watching TV.
Yeah, but if he just stays laying in bed for the rest of his life, then I don't think it matters.
Okay, fair.
That you see my point? Like, if you're not going to use your body ever, nothing matters. It doesn't matter if you curl up in a ball. It doesn't matter if you whatever. Now, if you're going to do anything where there's a physical demand on your body, do you remember when I wrote that article about squatting and hip anatomy?
Yes, I heard about this.
Yeah, so I wrote this article.
Did you go into like a legal pursuit after that too, or something? Or is that just
legal
rumor?
pursuit?
I heard there were some like legal things that happened with that, because that was about our friend K-Star, right? That was like a reactionary post? No?
It definitely was not a reactionary post, but I did get a lot of hatred from them, which made me very angry because I actually really admired what they were doing. And they like tried to basically crucify me. Okay. You know, like publicly shame me. That was was a challenging phase for me dealing with that. But it's an article I had thought about writing for a while when I learned about retro and anteversion in chiropractic school. And I was doing CrossFit at the time. And I'm like, okay, something's not adding up here.
Yeah.
If we know that people have retroversion, anteversion of their femoral like head orientation, and there's variation in the acetabulum, and when people squat deeply, they're going to the end range of the joint, right? Like if you're going to squat deep, I like to say this, like, if you were going to do like a push press where you're not going into a lot of hip flexion, it doesn't matter if you're retroverted, you're not going into enough hip flexion for the structure of the joint to matter, because you're not accessing the geometrical positions where where there's a limitation due to the orientation of the femoral head in the acetabulum. It's not deep enough. Now, if you're going to have someone squat really deep, you're going to find that the geometry of the joint dictates where the bones can move. Right? And that was my point. Like, if you're going to take someone to these depths and they're retroverted, it is like geometry.
It's physics. Yeah.
It is physics and it's geometry. It's literally math, right? And that was my point, dude. In CrossFit, it was like, we're trying to get people all the way down, all the way down. It's like, okay, but if you're going to do that and there's structural differences, you can't tell everybody it's just a stretching issue or a mobility issue when we know that 10% of the population might, has some degree of retroversion. And so, like, are we denying that there's FAI? Are we denying that there's impingements? Are we denying that there's differences? And so that was the whole point of writing the article. Now, the reason I bring that up, and there were no legal things, just some hatred and anger. But the reason I say that is because posture, if somebody says posture and alignment doesn't matter, you're essentially denying geometry. Because if you're going to lift heavy objects, there is clearly a way to stack physical objects that's better than other ways to stack physical objects. Like, if I take a column and I position it differently, one of those positions of the column will hold more weight than other positions of the column. Just take like a block, take a thing of bricks and stack them and then like orient them differently and like play Jenga, like obviously there's certain, so in that sense, if you're going to load your physical body with heavy weights and you're going to do any sort of volume of training, you will find out for sure that the positions you get into make a difference. Now, I think that is different from what people are trying to argue when they talk about posture mattering or not. I think what they're saying is that if you just have slouched forward posture at the computer, that doesn't necessarily correlate with pain. But I guarantee you, if you don't have the ability to reverse the curvatures of your spine and hold certain positions, and you try to train heavy or with any sort of volume or intensity over the course of a period of time, you will find out that getting into certain positions does matter. So, like, if you're not going to do anything, it probably doesn't matter. If you want to have a highly functional body, and see, I think what they would do, the posture people, is they would say, well, we're not arguing about the positions you get into when you train. We're just talking about posture.
Yeah.
And so even there, it's like, well, what do you mean when you say posture? Like, are you just saying that the way I stand? Well, some people, if they're really in a lot of lordosis and they stand for a long time, their low back gets stiff because they're basically just loading their facet joints, So I think I think it's like silly. It's like, why, if you're arguing, if you're going to like put this stake in the ground that posture doesn't matter, it's like, then why are you doing anything? I agree. It's like, you don't need to have somebody like cue somebody to like try to be in this. I don't think there's like a perfect resting posture.
No.
And I think maybe that's what they're trying to mean is like, no, there's no perfect resting posture. And telling people they have bad posture is making them hyper aware of themselves, and then they hold their bodies weird. And I think that's what they're trying to argue, and I just don't think they're explaining it well. And I would agree with that. Like, if you try to make someone too aware of themselves, then they hold all this unconscious tension to try to get into this certain stagnant position.
I see so many massage therapists and personal trainers that are so psychosomatic about their position and posturing and positions with training that they've like created their own pain and manifested it because like they think anything other than perfect is causing them pain. And I've even had people, like I had a massage therapist that she owned her business and she had pain mainly with sitting. And I had her take a picture of herself in her chair, and like she had this like big lumbar support under her, and she was trying to sit with her shoulders back every day. I was like, and like I had her then take a time lapse of it, and like she literally didn't move. I was like, you just need variability. Like take that out, do this, like move around a little bit more. Like variability is the best. Not like there is no perfect posture, but just as far as like, yeah, some of the stuff I've seen in the chiropractic field of, comparing the X-rays and kind of the fear mongering approach. And it's like, is there something to this that they're trying to get to, or is it?
Yeah, there's like a chiropractic technique sort of division called chiropractic biophysics. And they really spend time measuring all of those angles. Like their whole approach is trying to work on the angles that they see on the X-rays. But I think, and that's where I think it's like, it's a little bit more detailed of a conversation when people talk about posture. Mm-hmm. Because if you tell people posture doesn't matter, what happens? Well, it's like, well, nothing matters.
Yeah.
It doesn't matter what position you're in. You shouldn't, if you're going to lift a heavy object, it doesn't matter what they extrapolate it. And it's like, well, are we trying to tell people that they can do heavily loaded exercise and it doesn't matter the way that they position themselves? Because that's kind of what the posture doesn't matter side effect interpretation is. Mm-hmm. Is then people think it doesn't matter how you lift things. It doesn't matter what your technique is because posture doesn't matter.
Yeah, I hate that.
And it's like, well, it's a little bit finer of a conversation than that.
Yeah, like
hypervigilance while you're just sitting around is not good because you're driving all this muscle tone and you're holding your joints in these positions for like hours. Well, that's not good. But when you do heavy lifts, there's probably a way to put your body that's better than other ways, as per the example I'm telling of stacking weight on top of blocks.
As someone that coaches Olympic weightlifting for Team USA, I would say there's definitely beneficial postures to be in. And,
right. It's like,
and it was funny. I have a friend, actually, he's a reformed pain scientist, PT practitioner. And so a while ago we were on the phone. So he practices male pelvic health down in Louisiana, Will Mills. And he used to be all about pain science and not like very like anti-manual almost. And then he told me a while ago, I was like, yeah, I started trying it. I was like, that shit really fucking works. I was like, yeah, dude, I've been doing it for years for a reason, whatever.
Dry needling, is that what you said?
Dry needling, yeah.
Uh-huh.
And then, but then he was like, he's changed his whole tune because he was like, yeah, posture doesn't matter, that whole spiel that we had years ago. And then he's like, oh no, it matters because when you're working with a man that like they have had prostate cancer, their prostate removed, whatever, or just like pelvic floor issues, and like if they change their position, lose their pressure or their tension in their pelvic floor, you pee. That matters. That is still posture, and that shit does matter. And I was like, yeah, that is a great example of how posture does matter.
Yeah, exactly. I think I put up this quote like, I don't know, last year, and then I deleted it because it was like creating unnecessary controversy and stress in my life. And I was like, okay, I did not, I don't need this, you know? But the thing I put up was people who say posture doesn't matter have the worst posture.
Okay.
You know, it's sort of like a riddle, right?
Yeah.
Because it's like, if you say posture doesn't matter, you have the worst posture. And it's like, well, how do you argue that? Well, posture, it's like posture does matter because I don't want to have bad posture, you know?
Yeah.
And it's just to get people to think about this stuff of like, just think about it from a different perspective of like not being dogmatic. And also like, maybe people get a little bit too serious about topics that like, can it not matter a little bit?
Yeah.
You know, like it doesn't matter at all. I'm getting so angry about posture. It's like you just had a cortisol spike about posture.
Mm-hmm.
You know, like,
yeah.
What are we doing? You know, people are getting like viscerally angry about talking about if we think putting the human body into certain orientations to itself as being important or not. And it's like, it's just so obvious. It's like a table. I'm looking at this table. Mm-hmm. Well, if the legs weren't...
So let me ask you this. Is manipulation the fix for it?
Absolutely not.
Okay. That's all I wanted to know. Case closed.
Definitely, I think that manipulation is maybe a small percentage of the time something related, something anatomical. Mm-hmm. Like I believe that there's some studies that show that like maybe like some of the joint capsule can like get folded and then manipulating it like,
yeah.
I think it's mostly a neurological input. I mean, the way I always thought about it and think about it still is it's a way to stimulate the nervous system, mm-hmm. you know, and also just to basically like, I mean, this is still the nervous system, but like a person's experience of that joint getting into positions that it has not been in.
Mm-hmm. Yeah. It's like, oh, we exist over here to the left and the right.
Right. But again, that's also nervous system, right?
Yeah, exactly.
Because if they're thinking about it, the thinking's happening in their brain, and the brain is the nervous part of the nervous system. So it's like, so I would say like, I think it's probably like 95+% of the time a neurological effect. Mm-hmm. But I bet there's some anatomical stretching forces through the capsular ligaments. Something like I'm sure that there's some of that though.
Yeah.
But I would not manipulate thinking that it's going to change somebody's posture. Mm-hmm. I think it will temporarily allow them to move a little bit more easily, but then it's like there's got to be some sort of retraining there, I think.
Yep. Absolutely.
Some body awareness. How are you stabilizing your spine?
Mental health.
What are your
anxiety?
Yeah, like if you're stressed out and you feel bad about yourself, you're slouched forward. It's like the emotional contribution to how somebody holds themselves. I read this interesting thing on X that was talking about posture. And I just briefly read, I didn't like really look into it, but it was something like when males got into a certain more upright posture, it like they had like higher testosterone levels.
There's a couple.
So there's probably some sort of like emotional chemical
yeah. So there's
thing there.
There was two things I have recently seen. I was actually listening to a podcast, The Diary of a CEO. Do you know him? He's got a really good podcast. You'd probably be interested in it. He's like health, business, fitness stuff, but he had someone on that was a body language expert, and they were talking about men and body language and like how if you see a guy, say you're walking down a hallway or something, you see some guy that you don't know, and you typically you kind of drop your head and like say hello this way. It's like you're not opening.
Yeah, the guy
you're like, hey, hi, like whatever, and you give them like a downward nod of your head. And it's like, this is, your neck is a very vital area, versus you see a buddy, and they're walking down the hall, you give them the nod up, like, hey, what's going on, man?
What's up, bro?
So it's interesting on like different postures in environmental situations with where you're comfortable and not. And I thought about it, I was like, that's actually really true. And then, and I'm not going to say I'm a fan of him or not, but years ago, everyone was talking about 12 Rules of Life by Jordan Peterson. And very controversial figure, I know, but I started.
I read that book.
So the whole first thing on lobsters, I was intrigued by the whole like the confidence building of the lobster, and the lobster gets bigger and all that, and like they take on a different posture because they're winning these like the lobster wars or whatever. I basically shut the book after that because his language was way too over my head, but
a little unnecessarily complicated.
Yes, but it was just something interesting about posture and like the psychological side of it.
Yeah, I was going to this. I went to this yoga school in Buenos Aires for like 2 years. I basically went every day and practiced and like studied their entire method and philosophy and everything. And they do a lot of techniques, like the way they put the tongue to the roof of the mouth at the same time they go into like a full cervical extension, and talking about like how the idea is you're basically like compressing and squishing and stretching like the glands and stuff. And I mean, how could that, again, my ex that was a operating room nurse, she would tell me like they would do a lot of like heart surgeries, and like sometimes when there was like if the heart stopped beating, the surgeon would like, because they had the chest open, they would like massage the heart to get it to start beating again. Like they would manually stimulate the cardiac tissue, and it starts beating. And so do we not think that if you go into full cervical flexion and then full cervical extension and you do that like that, we're kind of mechanically squishing and massaging things?
Interesting.
Because if that works with the heart, why would that not, like if you think like your salivary glands, like if you press on them and it's like saliva comes out, it squirts out. So I mean, that's like an interesting thing with like, going through full range of motion in your body is like, it's not just about the joints either. Like the way your entire system is getting twisted and pulled on and all that kind of stuff. Like, I don't see how that couldn't matter. Like seems like it just kind of keeps everything a little bit juicier.
Yeah. Interesting way to think of things that I've never thought about before. So I'll have to,
like, I've been doing a ton of trying to get more cervical extension, like holding different amounts of air in my lungs. And like, I was like, dude, the front, like it's not just the muscles in the front of my neck, but like all of the other tissues, I start to feel like, okay, this is not muscle. This is like my esophagus,
Really?
Like my esophagus is short. Or like my trachea is like the restriction, and like, how does that pulling on that affect everything? Super weird, man. Like I was doing these like 3-hour flexibility classes like once a month with this yoga instructor lady, and dude, there were times when it was like, there was this one position that we would go into and it was like the biggest stretch on my femoral nerve I have ever felt, and I swear to God, I felt it pulling on my brain.
Okay.
Like it was like, oh, I feel that in my dura,
Wow.
And it was like shocking to my psyche. And then like when we were done, I was like, floating in space, like I was like, okay, there's something going on here. Like, because obviously like your femoral nerve is big.
Yeah.
And if you're pulling on that, and like I literally felt it in my head.
It's interesting.
Like what does that do, Like you're pulling on that entire thing, which makes sense too, right? Like if you do a straight leg raise test,
yep.
and someone has a disc herniation and it creates radicular symptoms, like you are doing that, right?
Yep.
Like you're literally
pulling on the nerve.
You're literally taking their ankle into dorsiflexion, plantar flexion, and they have a disc herniation at their L4, L5, and it either, it alleviates or recreates their symptoms depending on the tension you're putting in the sciatic nerve due to the dorsiflexion. So it's like, if you think that that's true and you're doing that in an orthopedic test, then what I'm saying should make sense.
Yeah.
Right? Like I'm pulling on the femoral nerve and I'm feeling it in my head.
Mm-hmm. Yeah.
And it's like, and then it's like, I'm observing these like old men walking around the street, and like when they're so crouched forward,
yeah,
it's like, dude, that is not just joint tightness, their entire, like their lungs are probably tight,
yeah,
their intercostals are tight. Their entire fascial stuff is tight. That's why they literally can't even, it's not just like, oh, just manipulate their thoracic spine. It's like, there's like remodeling that has to happen there. Their nerves are tight.
Yeah. Yeah. There's definitely a lot more that goes into it than just manipulation for someone like that, for sure.
Yeah. I remember in Chiro school, like third quarter, this one instructor was like, we were doing like a case study in class, and he was talking about this, his own personal experience where we had to guess what was going on, and he was describing the symptoms, and we're all like sciatica, disc herniation, and it turned out he had a kidney stone,
Oh, yeah.
And they taught us that like super early in the program to be like, don't assume it's orthopedic.
Mm-hmm. Yeah.
You have to assume it could be anything.
Not a metastatic lesion on a femur.
Right. It's like, just because someone is limited in their ability to extend their head upwards doesn't mean it's because their thoracic joints are stiff.
Yeah.
There are a lot of other tissues that can restrict motion than just the joints too.
Mm-hmm. Yeah, absolutely.
And that's one thing I always liked about what Kelly Starrett taught, was like, it's like, we're pulling on all the tissues. Whatever the limitation is the thing that you're going to pull on. It's like, to try to figure out exactly the tissue.
Mm-hmm. Very hard.
Is sometimes like unnecessary. Like he would talk a lot about like getting into certain positions, and it's like, it's more important that you're trying to get into certain positions, and whatever's limiting you is going to be the limiter.
Yeah.
To try to like spend the time to figure out like what is the exact tissue is probably impossible to know anyways.
Yeah. Yeah.
I mean, you could figure it out to a degree, but at some point it's like, there's a lot of stuff.
Yeah. Andrea Spina has a great quote with his mobility training is just, you can't move where you can't move. So let's try to get in there and move it more than you can right now.
Yeah. Yeah. And I think that's a really great way to look at it, that like, some people will think is too simplified and kind of dumb, but I think that the longer you think about these things and the more you work on them yourself and with people, and the more honest you are with yourself, it's like, yeah, I can't know if it's because of this muscle or I mean, like if you're doing a neurologic exam and you're taking the ankle into dorsiflexion or plantar flexion, it's like, well, there's only so many things that cross the ankle and the knee and the hip. Mm-hmm. But like, if you think about me taking my head back, I mean, all this,
yeah,
it's not as simple, I think.
No. I think that wraps up everything on the chiropractic versus PT realm for now. We've got like 2 hours here, but the last thing I wanted to go over.
Okay.
You had him on your podcast, and he is one of the, I don't even want to say it yet, but I commend you for, and part of why I think I always loved your podcast was you were open-minded to people and willing just to sit there and learn and hear what they had to say. And so with Joel Seedman, you sat there and tried to hear him out, but I see his stuff on social media all the time. It doesn't make sense. There's no science behind it. He touts his own research, but then won't post it. What are your thoughts there?
Yeah, so I think that you can learn stuff from everybody.
Okay.
And some people, what I learn from them, and I'm not saying this particularly about Joel, but some people, what I learn from them is what I don't want. You know, like if I have a friend with bad habits where it's like, there's nothing I can learn from this guy because, you know,
learn what not to do.
Right. It's like, well, I'm learning that, you know, doing this isn't good. Right. And so I try to take that approach where it's like, there's something I can learn from everybody. Like, hey, this person talked to me in a way I didn't like. I learned that I need to make sure I don't talk to people like that, for example. So I try to take that approach with everybody. I also take that approach as a side when I unnecessarily spend money on things.
Okay.
Right? Like if I spend money on, let's say you were speeding and you get a ticket, you know, and you're all pissed. It's like an unnecessary amount of money. Like you didn't have to do that because it was a mistake, you know? I think of those things as like tuition. You know, it's tuition. There's a lesson in there. Make sure that you learn a lesson that's more valuable than the money that you spent on whatever thing that was.
Okay.
Anyways, so I'm always trying to learn from things rather than get mad or upset or be critical. Now with Joel, his thing that he proclaims is 90-degree joint angles are the strongest joint angle to create force while minimizing stress on vulnerable tissues. Essentially, that's what he's saying. And I think that I've been trying to figure out, like, okay, if you listen to like what McGill says about the lumbar spine having there's a mechanism of injury to a disc if you compress it and then flex and extend it a bunch of cycles, right? I mean, that's like, if you were to put in a nutshell what McGill is saying, it's that, I would say, right?
Yeah.
Don't compress heavily and then bend and extend the spine. And then you look at like Greg Lehman and what he's showing where it's like, well, when you deadlift, your spine's flexing 20 degrees anyways.
Yeah. 40, okay. Actually.
Is that what it is?
40, yeah. He's coming on the podcast soon.
Okay. Yeah, he's fun to talk to.
Yeah.
And it's like, well, how do I reconcile that?
Good pun.
Thanks. And then I think about like a Spina, or I think about a Naudi Aguilar, or I think about a natural. Is that the functional
patterns, dude?
Yeah, I need to get him on. I think that would be interesting. You should get him on too.
All right, yeah, let's do it.
I'm gonna try. 2025. I'm gonna put my goal is to have him on because I think that it would be a very interesting conversation because I think he has a lot of good ideas. But I think he purposefully inflames to get attention. And he admits that he does that, by the way. Like if you read his comments, he's like, I don't want to have to do this, but you people won't listen to me unless I make it controversial. Otherwise, people ignore stuff. And it's like, okay, at least you're honest about it.
Okay.
And then I think about like the natural movement people, and I think about like, how do you make sense of all of that? It's like, okay, do I want to load my body as heavily as possible in vulnerable positions. Okay. I read this study, maybe you know this better than me, but like I believe I read this study that showed that like if you train a joint, you get adaptation in 20 degrees range of motion larger than the range of motion you trained.
I think it's 10.
Is it 10?
10 to 15, okay. I believe, but either way.
10 to 15. If it's 10 to 15 degrees, then why the hell would I train as far as possible if I could actually, because when do injuries happen? It's usually people tweak something like when they're pushing the end ranges with heavy loads. At least for me in my personal injury history, it's like when I'm at the end ranges lifting. And I think about it like, at least for me, like when I've deadlifted, when I've squatted and tweaked something, it was like at the bottom.
Okay.
So I don't think that means we should not train spinal flexion or go into those positions and be able to own those positions.
Yeah. Well, his whole thing too, though, is like 90 degrees, like train everything to 90 degrees. So it's like knees at 90 degrees, hips at 90 degrees, chest only come elbows to 90 degrees.
Yeah. But what he's saying is when you're doing your heaviest lifts, do your heaviest lifts in essentially a shortened range of motion.
Yeah.
To decrease the potential for injury by going beyond those ranges. So like, let's just say that's his argument. So how do I use that information in a way that might be helpful? It's like, okay, well, if I'm going to train really heavy, and I know from my own training history that I've tweaked and been injured and all of that stuff, do I need to train these really heavy lifts through the largest range of motion I can? Or can I train those heavy lifts through shorter ranges of motion to get like the nervous system output and just the tension in the tissues? Because if I lift really heavy through a shorter range of motion, I'm getting a ton of tension through my tendons, through my muscles. Okay, so if I train my heaviest lifts in a shorter, better controlled range of motion, let's say, when I'm doing the heavy lifts, and then the other parts of, and this is also something I kind of like mixed with Jason Brown and his, the way he does conjugate. Like in conjugate, they do like 20% of their volume are like bilateral heavy lifts, and then 80% of the volume is single joint or accessory exercises. And it's like, okay, why would I not? I'm not an Olympic weightlifter. I'm not a competitive power lifter. So for my own personal way of training, why not shorten the range of motion a little bit for the heaviest lifts and then do larger range of motion on my lighter accessory lifts where I can work on the quality and the coordination. And that's kind of how I interpret what Joel's saying. And I tried squatting and benching in a shorter range of motion, and I swear to God, my joints started to feel better.
Really?
And I have talked with other people behind closed doors about the 90-degree thing and doing the heavier lifts in a shorter range of motion in conjunction with accessory exercises and movement-based work through larger, fuller ranges of motion that are not segmented. Right? Because a deadlift or a squat, you're kind of segmenting.
Yep.
You're holding your spine stiff and you're moving at your hips.
Yep.
And it's like, well, if you go to that very bottom range holding a fixed pelvis, you're kind of jamming your femur at the bottom. And you're kind of like fighting like a jammed femur versus a flexing lumbar spine at the lower segments. And based on what McGill is saying, I don't necessarily want to be bending it under load, and I definitely don't want to be jamming my hip joint, but I want the benefits of heavy training. So what if I do that heavy training where I don't run into those compensations And then when I do lighter training, I let my spine bend, I let my pelvis rotate. So I have sort of that more natural way of moving, but then I still get the benefit of heavy loaded exercises that have a lot of compression and require a high level of nervous system output and also put a lot of tension through the tissues. And I've talked with some other very high level people behind closed doors who are like, I kind of think Joel might have like, I don't think it's like the perfect way to approach training, but like, I don't think I want to totally disregard some of the things he's saying and like the reason why he's suggesting that. Now, I don't think this 90-degree thing is like, I need to get a protractor out and measure my lifts.
No.
And I even challenged Joel, like, well, what about like, if my hips can move with my toes pointed out and I can do a sumo deadlift or a low bar back squat, and like, why would I not train those positions also, Mm-hmm. And that's where we had a disagreement, I think, is like, I would rather train a large variety of positions and exercises, both heavy and slow and fast and light. Mm-hmm. And then I want to also train the non-segmented way of moving where I let my spine bend with my hips bending and I let my spine rotate with my scapula retracting and elevating and my glenohumeral, like, so I can combine the best things that like Naudi Aguilar is saying of like, you need to be like twisting your spine and and doing all of that, which I think is missed in a lot of sort of like conventional gym training, is like we become very sort of like robotic and stiff in these like combinations of movements. Mm-hmm. And so I don't know, my approach has always been like, I don't want to criticize Joel and like what he's preaching. I don't agree about the 90-degree thing. I'm not convinced. But I also don't think it's a bad idea to do heavy lifts in shorter ranges of motion. It's in some percentage of your training, rather than training the heaviest lifts to these end ranges of motion all of the time. And that's sort of my conclusion about that.
Yeah. My thing is, his whole thing is doing it to prevent injury, but it depends what you're training for, I guess, too. Like, if you're just training to train, then cool, I guess. But the other side of the coin is, well, we're only strong in the positions we train. And there was a study that recently came out showing Olympic weightlifters on radiographs and imaging have... Because there was some surgeon that was like, don't squat any more than 9 degrees. Like, don't squat ass to grass for knees. I was like, actually, weightlifters have the best imaging on X-ray and MRI because we're moving that joint to end range and loading it every time. So it has the most tensile integrity, the best soft tissue or articular structure. So it begs the question of that. And it's like, my other thing too is... I coach both weightlifters and powerlifters, right? Mm-hmm. And so when I look at and I treat weightlifters and assess them, so those that are moving heavy weights to a full range of motion, pretty much for the most part, day in, day out, as long as the load is forecasted, and projected right, we shouldn't really run into that many injuries, right?
Like the volume.
Yeah, as long as things are, the principles are there of your programming, we shouldn't see too many injuries. Granted, it is a sport where you're trying to, you go into a competition to find what your max capability is, so injuries will happen. But in the most part, we don't see that many injuries, and everyone like has significant good mobility. And I don't see a lot of issues where when I treat powerlifters that are moving typically half as much, I see a lot more hip impingement. What do you
mean? What do you mean by half as much?
Like range of motion wise. So like a low bar squat is more of like a 90 degree. Like they're not squatting ass to grass, right? When they're benching, they're manipulating the shoulder and the T-spine to shorten that range of motion as best they can, especially for men. We see, I just see a lot more. And so all that tension can be good for powerlifting, but outside of that, these guys get hurt doing other exercises. They can't go overhead anymore because their pecs are so tight and because they've only been training a partial range of motion.
Right.
And so it's like, is it really better? I don't know. Granted, however, in the same breath, like West Side and, like board training, like a lot of these guys will do some regular bench work and then they'll work up and they'll put a board press. They'll do a board press with like 6 or 7 inches of reduced range of motion to feel heavier load or whatever.
Right.
So
and that's what I'm saying, where it's like, in my approach, not being a competitive, weightlifter or whatever, it's like, if I look at how conjugate training is, where they're doing variations of these exercises, both in range of motion, in grip width, in apparatus, in rep schemes, etc. It's like, why not combine that then with also doing full range of motion accessory exercises that work on these combinations of thoracic rotation and overhead range of motion? Because we know, like you said, when you look at a lot of power lifters, they're big and they're beefy and they're strong as hell, but they can't move, and they've developed so much stiffness that their joints kind of end up getting beat up, right?
Yep.
And it's like, well, why not take the best of that and then do these other amazing tools and exercises that we know about, like as, rehab type people, and do some overhead single arm kettlebell type stuff, or like, like some of the stuff that in functional patterns where they take like a stick, and they're like in a, like a lunge position, and they're like rotating and moving their spine with the scapulae and their glenohumeral joints in like a very coordinated way. Because that's like swinging a bat.
Yep.
I don't know. I've kind of gotten to this point where I feel like there's like 4 or 5 domains that we should be training in, like to kind of like express the functions of a human body.
Yeah.
So I would say one of those is locomotion. So running, walking, climbing, swimming. So I'll call that the locomotion category. Another category I call moving heavy objects in space. So I'll put that like Olympic weightlifting and powerlifting. And then I think another category is, I call it ragdolling. I don't know why I thought that term up, but like, like a ragdoll can sort of just like flop and all of their joints will just twist together in the range of least resistance.
Okay.
And I think that if I were to design a human body to be as optimal as possible, because I think of like that yoga lady that taught this 3-hour, like she could just, whatever combination of her spine and hips, her body could just fold in all of those. So she has just all of this availability. And then I think another domain would be, I call it limb whipping. So whipping, using your entire body to create a whip. So that would be like kicking, punching, throwing, using your entire body to whip something. I think that like, try to get a power lifter to like whip. I don't think they could do it because they don't have like that sort of coordination to rotate their trunk and let their glenohumeral joint like slip and slide to create a whipping force.
Have you seen Eddie Hall boxing?
No.
Yeah, you should watch it. That's
okay. Right.
You know who Eddie Hall is, right?
No, I don't.
World's Strongest Man. Him and Thor Bjornsson, the mountain from Game of Thrones. They're 2 professional strongmen. They were supposed to have this big like charity boxing match, but like Eddie Hall deadlifts like 1,100 pounds, and like he's world's strongest man and strongman. So you should watch it. And that's exactly what you're saying is, they can't throw or punch.
Yeah. And another classic example of that was like the CrossFit Games in 2011, where they had to throw a baseball or a softball as one of their events.
Really?
And you have the quote unquote world's fittest athletes. They can't throw a freaking ball, dude. It's like, you can't, like, that seems like an expression of the human body that you would want, is the ability to generate force and then have that force leave through one limb. So I call that whipping. And I kind of think like that's what functional patterns is kind of doing, is like the whips.
Yeah.
It's like doing everything to like, you know?
Yeah.
And then the last one is, and then another one I would say is like unexpected reactionary. That would be like play, you know, like playing, like you don't know what's going to happen. You have to react to it.
Yeah.
And then the last one is rhythmic, like dancing or something.
Okay.
To like be able to like rhythmically move your joints together. So I think if you look at like a human body, everything that you would want for like a maximally, let's say maximal surface area covered of what you could do with your body, I would like categorize it like that. So when I listen to Joel, like that's how I'm thinking about how to take what he's saying, is like, okay, I'm going to put what Joel's saying in the moving heavy objects in space. And I'm going to try to see like if I move heavy objects without full joint excursion, because I'm getting full joint excursion in these other things. How does my body feel?
Yeah.
And so I don't want to say that he's wrong, but it is one of those things where it's like, if you keep saying something over and over and over and over again, and then suddenly the whole world's paying attention to you and you have 500,000 followers, what do you say? I was wrong.
Yeah.
I mean, it's like,
yep.
So I don't agree with that. I think that all you have to do is watch the Olympics and you can see that all of these people are lifting massive loads going beyond 90 degrees, and they would not be able to do that if they were all getting hurt. So therefore that whole theory is not true, because if it was true, they would all have blown themselves out before they could even lift that heavy of a weight. Right.
Yeah. I'd say too,
But,
there's, and maybe it's an absolute versus relative load, but lot more quad tears I see in powerlifting than weightlifting. And again,
quad tears.
Yeah.
In the squat.
Yeah. And I can't prove that. Like I can't say statistically, but from what I've seen on Instagram in the clinic and stuff, like I've seen one quad tear in an Olympic weightlifter. I haven't seen any from anyone else.
Yeah. Powerlifting's a kind of a strange sport, I would say. It's like very artificial to me.
Yes. You
take this perfectly symmetrical bar and you're like trying to lift maximal weight in these just linear movements. And you're doing all these weird positions to like be able to do it. I don't know. It's not like a well-rounded approach to training. I mean, Mike, have you ever talked to Mike Boyle?
No, but he's, I'm trying to get him on too, but he's close. He's like, his gym's like 30 minutes from mine.
Have you ever been there?
I have not actually.
It's a cool gym. You should go see it.
Yeah.
But yeah, he always makes a joke. Like I've talked to him a couple times, and he's always like, "Oh yeah, don't even get me started on powerlifters. These are like the least athletic people I've ever seen in my life." Like he loves to hate on powerlifters like that, because he's like,
well, he doesn't like he doesn't like the back squat either. So,
right, he's against like loaded heavy bilateral squatting. But I think that's also. And so I think that he and Joel kind of share a thing where they're like, we're doing strength training to help these athletes play football. We're not training Olympic lifters. We're trying to help field athletes. And field athletes, if I keep them in these shortened ranges of motion, that they don't get into these deeper ranges in their sport. And if I can sort of like avoid those ranges that might have a higher incidence of injury, and my job is to train them for the field. Because like if you look at like a LeBron James or these like NBA players that are like highest level athlete in their sport, they're not doing Olympic weightlifting, and they're the best athletes in the world. And so that's where it's like, there's
no money in it either though. In weightlifting. There's no money in weightlifting.
But I mean the best athletes in their particular sport. Like if doing Olympic lifting made a basketball player better at basketball, I guess like an argument that somebody would make is if Olympic weightlifting made a basketball player better at basketball, we would have figured that out by now, because there's so much money involved that somebody would have been like, all my basketball players are way better because they're doing full depth squats. And the truth is, I don't think any of them are doing that.
Yeah.
And so then it's like, well, is what Joel and Boyle saying wrong in that field athletes don't need that for their sport and they can't justify those specific lifts for those athletes in the small percent chance they tweak at the bottom of a heavy squat or heavy deadlift?
Yeah.
I think that's where they're coming from.
And
when they say that.
I think Boyle used to be against it for the forces on the spine, whatever. And I think he's since redacted that statement, but he still stands by his training stance on not teaching the back squat. Just for his model, who he's training, they don't have time, and there's no reason for kids to be doing it for the sports they're doing and the applicability, which makes sense to me. I agree with that.
Right, it's like easier. It's like easier to get them to just do split squats.
Yeah.
It's easier. It's less technical. They don't have to get their arms back like this, and then their shoulder hurts, and then they can't shoot the ball. Like,
yeah, it's too much. So I totally understand it.
But I am against this whole, like, you have to lift this particular way, or everybody else is wrong and I'm right, and it has to be at this exact angle.
Yeah. Agreed. We'll leave it. So, we can leave it at that.
Okay.
Oh, this is the long. I think we broke my record here for the longest podcast so far.
Nice. It's good to break records.
Yeah. I have to go because my dog just had surgery and he needs to go out in a minute here. He's chomping at the bit.
Okay.
But anything else you wanted to add, Ryan? There was a lot here. I appreciate your time.
Anything else? I think we put in. I think there's plenty of stuff in there.
Yeah. And if people want to reach out, where should they find you? Where can they find you?
Just go to they can just go to themovementfix.com, which is basically my website, and my mission with that is to basically help people understand their bodies. And I think of it like this. We all have been tasked. I'll end on this little statement, this little sort of mystical, philosophical way of seeing things. We all, previously in human history, we did not need to train our bodies on purpose because survival itself required us to be physical. Now, in the modern world, we have to intentionally train the human body, which means every single person who wants to be healthy has to train a human body from the inside, you know? Like, imagine have you seen all these like humanoid robots that are coming out?
No.
Okay. You got to go on X and watch all this stuff. There's all these companies making humanoid robots.
Oh, yeah. Like Boston Dynamics.
Tesla, a bunch of Chinese companies. I think we're going to learn a lot about human movement from how these robot engineers get the robots to work. Like, because they're going to look at like the way these things move from like the ground up, almost kind of looking at humans or whatever. But imagine if you had a job to train, you had to tell this robot how to get stronger. It's like, how do you do that? Well, we all have to train our own body. And we have to know how to train appropriately a human body, this like highly complex biological organism. And we all have to do that now because we can all sit around on a computer doing nothing all day and make money. We don't have to go out and like do physical work. Mm-hmm. So my whole thing is like, I'm trying to basically with Movement Fix, help people understand how to do that and how to understand their body without like the weird dogmatic stuff that people like to push for their own sort of popularity agenda, you know? Mm-hmm. So anyways, if anyone wants to go there, go to themovementfix.com. You just go to contact and fill out the form and send it to me.
Awesome. Well, Ryan, I really appreciate all your time, and it's a really good conversation. There's lots of good nuggets here. I'm going to have to put all over social media about a Chiro talking shit about Chiros.
Do you think was I talking shit?
No. Well, I mean, there's the parts of it. Like, I talk shit about PT all the time. So, it's the same thing.
Yeah. Sometimes a little shit talking's needed.
Yeah. People are like, oh, I did PT. Didn't work. I was like, yeah, you went to McDonald's. Like, just go to the Capitol Grill. You'll have a different experience. So,
It's true.
Yep. So, anyways, thank you so much for being on. Pretty cool that the guy you used to listen to that like I thought was like big and famous as a person in the rehab world is now on my podcast. So I feel like I made it. I'm accomplished today.
You did it.
I did it.
Congrats.
All right, man. I appreciate it. Thank you again.
Yeah. Thank you. Appreciate it. Thanks for having me on.
Of course.